Howard Rollins with EHR TV. I'm here with Rohit Nayak at the HIMSS 2012 conference. Rohit Nayak is the Vice President of Physician Technology Solutions for Quest Diagnostics. Their product is Care 360 EHR. Rohit, thank you very much for being here with us.
Good to meet you.
So here we are at HIMSS. Tell me a little about why you're here and what you're showing.
Well, HIMSS is the landmark show for the healthcare information technology industry, as we all know. MedPlus, which is the creator of Care 360 EHR, is the fully owned subsidiary of Quest Diagnostics and has been, and is responsible for all the customer-facing technology that Quest Diagnostics offers. Over the years, we've expanded our Care 360 platform from being just a lab orders and results solution. We added e-prescribing. And over the last 2 years, with the changes in the industry, we started to introduce our EHR solution.
So this EHR solution is rather new.
It's relatively new. We certified with the new certification standards that ONC put out in December of 2009, I believe. So it's 2 years in that range that we've been in the marketplace. And we believe that Care 360 by itself has a footprint of over 200,000 physicians and 80,000 physician offices that we've all developed over the many years that we have. And so we see a natural progression for our physician customers to progress and migrate to our EHR solution.
It seems like it would be a natural progression, as you say. You're starting in the laboratory business, which you're experts at, and now here you are creating one of the very, very fine EHR. Tell me a little about what makes it special.
Sure. Just based on the background again, I mean, we have a lot of familiarity with the small physician practice, the independent physician practice. We built the solution from the ground up, looking at the interests and the needs of the small physician practice, which contrasts us tremendously from most of the players in the exhibit hall here, who were primarily solution providers for the larger physician practices. The biggest opportunity in the market, as you know, is in the small physician practice. We think the needs are dramatically different. The needs are dramatically different in the sense that we didn't build our solution from the standpoint of upcoding or just achieving a paperless office. We built it from the standpoint of providing clinical information to the provider at the right time, in the right place, so they can do what they need to do in an effective manner. We looked at it from a standpoint of understanding the workflow of what happens within the office, rather than just trying to say, what's the most effective or the most highest upcoded encounter note that one can produce. So we believe that we've understood and adopted the adoption factors that are so important for us to achieve the successful adoption in the industry, and we believe that given the track record and the progress that we made in the last 2 years, that we have something special.
Can you give me an example of how Care 360 will impact workflow in the doctor's office?
So the key point here is really the flexibility that Care 360 allows. Care 360 doesn't necessarily dictate and say everything in the office has to be done in an automated manner. It doesn't dictate that there has to be one individual for scanning, one individual for writing a note, another individual for approving. If you think about the small physician office, which I know is your background, you have one individual wearing multiple hats. And so you don't want to create an artificial scenario just for the purposes of automation. So that's the key input that we put in, which basically says, here's a solution that gives you the flexibility to adapt your workflow as you must. We recognize that there are some requirements, that there's some workflow changes required, but certainly not to the magnitude that most of our competitors require.
Right. Now, I know with EHRs, one of the big, it's a detail that is very important is interfacing. Tell me a little about interfacing with Care 360. Who can you interface with? What kind of data can you capture? And what kind of data can you send out?
Excellent. Key points. I mean, I appreciate you bringing this up. We see, from an EHR standpoint, 3 major tenets. One is what we call interoperability, which is the point that you brought up. The second is what we call accessibility. How do people use it? Where do they use it? And what's the usability of it? And the third is the clinical dimension. So clinical decision support. How do they use the clinical aspects of the information that they have? Let me start at the first. On the interoperability standpoint, we're clearly experts in the clinical transaction space. The same network that Care 360 EHR runs and manages over 1 million transactions daily. Right? So we have that expertise down, and we provide interfaces using that platform, the same technology platform, to other hospitals, to other labs, to radiology services, transcription services, and the like. So we have that process down in a very significant manner. In fact, what we do is we also offer a solution not just to individual practices, we also offer it to hospitals. Every hospital over the last 5 years has made some sort of a technology decision from an EHR standpoint. But if you ask them what their pain points are, they'll tell you that independent of their amount of money that they've spent or the amount of time that they spent on it, they only have about 10 to 15% adoption in terms of the overall implementation of the EHR.
And why is that?
We believe it is because of all the factors that I just talked to you about. A lot of these solutions are expensive, ask for a lot of commitment on the part of the users in terms of disrupting their office, changing their office, and these are all based on the encounter notes, right?
Right, and I've certainly heard a lot of that from my colleagues when a new system comes into the hospital. So clearly, the important thing is to make it easy and not interrupt the doctor's workflow, and it sounds like that's what you pride yourselves on.
Absolutely. One of the key things, and we're all learning in this marketplace, one of the key things we learned over the last few years is especially with the advent of the iPhone and the iPad, phenomenal devices in terms of the usability and the accessibility. And our solutions, although we still call it as an extension to our primary solution, have gained vast utilization, much more than we expected, frankly. We have physicians, and you're a physician. Most physicians are not the first to pick up a piece of technology and say, I'm going to use that.
That's right.
We have physicians calling us and saying, how can I start using the solution tomorrow? They have their own devices, they have their own phones, they have their own iPads, and we built a native application that's for those devices. So we're seeing a lot of change in the industry that is phenomenal, that is going to drive that adoption curve that I think we're all looking for in the industry.
So a hospital goes ahead and makes the commitment to bring Care 360 into their facility. Tell me about the implementation. What do you do for the facility? How do you make it work?
That's a great question. So that's been one of the hurdles, right? I mean, so how do you actually, A, get the buy-in from the physicians, B, get the cooperation in terms of implementing it? Based upon our experience and what we've seen is with our light touch solution that we have, which is a software as a service, cloud-based solution, the level of touch points that we need with a physician office can be pretty small. It doesn't have to be the same engaged 1 week, 2 week, 3 week, intense, shut down your office training exercise. So the way we do it is use a combination of online training, we use a combination of remote training and on-site training. So we have the ability to offer all of that over a 4 to 6 week period. And we feel confident that at the end of the 6 weeks, our physician practices are ready to begin the recording process that is required for meaningful use attestation. That's the level that we believe that we can get our physician to, and we're so confident about it that as a result of that, for this show, we announced a promotion that guarantees our hospital customers the 30-day implementation cycle.
I heard about that guarantee, and I wanted to hear you say it here to me. Is that a new? That's
it's
a new
brand
offer?
new. It just went out today, and so we believe we're touching a nerve that is at the core of the needs of a lot of the attendees at this particular conference, and so we've seen evidence of that behavior, and so we certainly believe that it's going to provide a lot of benefit for us going forward as well.
Now, with it being cloud-based, let's talk a little about protected health information and what Quest does to make sure that this information is completely secure.
There are well-regulated and documented rules in terms of what are the access requirements. So every user has their own login and password. The data that is transmitted between the end user connection and the host systems is secure by the highest security standards. So we feel as if, based on our experience, we've always offered a cloud-based solution. We have a secure network, and we do enough to provide secure and controlled access to that particular network for our users. So we're pretty confident about our ability to adhere to the privacy laws, as well as the security laws that are associated. From a privacy standpoint, sometimes that's the tougher challenge because there are a lot of people that work around a physician practice or a hospital that want access to that data. And we take a lot of pains, sometimes not very favorably, to make sure that we have the right consents and authorization before we do any of that information. We manage, because we control and manage so much patient information for the millions of patients that we deal with on a daily basis. It's a very important factor for us as Quest Diagnostics.
That was a great answer, and we covered a lot of information. It seems that we've chosen the right person at the company to speak to. We've got the answers. I want to thank you very much. It's very exciting what you mentioned, and I wish you the best of luck.
Thank you.
Thank you. Rohit Nayak, Quest Diagnostics.